Hey guys, I don't know if you've seen this picture of Naldo. He's a Brazilian musician who apparently had his nose injected recently and looks like he got some necrosis of the skin of his nose. So a few teaching points. Number one, make sure that any practitioner who's doing non-surgical rhinoplasty can recognize impending ischemia and necrosis and understands that what you're looking at is not bruising, is not sunburn or like any other thing, but this is clearly necrotic skin. It's not necessarily super deep necrosis all throughout his nose. There may be an area of depth around his ala, but it's unclear. I can't tell from the pictures. But it's important to be able to recognize ischemia early on, so you recognize blanching, you recognize any kind of pain that happens before it develops into something like this, like necrosis. So that's the first part, is be able to tell when you have a problem. But before that first part, you need to make sure that you're taking precautions that are appropriate when you're injecting the nose. And I've talked about this before, but safety precautions when injecting the nose, it comes down to one very important principle, which is that you should never be injecting large amounts of filler in any one place under high pressure anywhere in the face, but especially when you're in the nose, because you don't know where the tip of your needle is. There's no way of really knowing in the moment whether the tip of your needle is inside a blood vessel or not, and I really don't believe that aspiration is a good way of knowing where the tip of your needle is. So you're taking precautions, which means that when you're injecting the nose, you're backfilling into a 0.3 cc BD syringe, which has a tiny needle. It's a small syringe. You can inject very tiny amounts, so 0.01, 0.02, 0.03 cc's. And that's really important for precision, but also important for safety. So that's first safety precaution, is that you're using the right tool, which is that BD syringe. Second important safety precaution is that you're not pushing hard on the plunger when you inject. So you're being very gentle, you're injecting very slowly. Third safety precaution is you're always moving as you're injecting. So if filler is flowing through the needle, you should be moving that needle out. Because again, with those BD syringes, you can't aspirate anyways. And I don't think that aspiration is a good and accurate way of knowing whether you're in a dangerous spot, because when you aspirate, I think it's physically extremely difficult not to move the needle. And you know, these vessels are really tiny. Even if you move the needle 0.5 millimeter, you can be in or out of a vessel. So aspiration doesn't make any sense to me. And if you aspirate, you can't move. And I think movement is a much more reliable safety maneuver than aspiration. Of course, the other precaution is that you're always being very careful to cleanse the skin repeatedly during the injection, whether you're using alcohol or whether you're using chlorhexidine or hypochlorous acid. Keeping the skin clean is very important to decrease the risk of any bacteria going in with that needle, especially considering that you're putting in injectable implants, essentially, because these fillers last such a super long period of time. And what I'm saying before about moving the needle, I think that's important for safety, but it's also important for your results, because when you're moving the needle, you're getting filler into all the different planes of the skin, and you're getting better lift to the skin. So your results will be better, your results will be more precise if you're moving. I think it's a better strategy.